It completely took over my life. I found it hard to even, function. These symptoms and these pains that no one could tell you what they were, it was like an alarm bell constantly in your face going, rah, 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 and you couldn't do anything about it.
Oh, it was just awful. It wasn't just during the daytime, it was all through the night, waking up again and again and again. Your mind is always on the bladder.
Laura and Sally have both spent years battling what are known as chronic urinary tract infections, a condition that technically isn't even recognised in Australia.
You're dealing with the symptoms, which are in itself debilitating. You're dealing with the system that can't give you any answers, doesn't seem interested, dismisses your symptoms, and the first thing they want to tell you is that you've got anxiety or you're a bit hysterical.
UTIs are common. 1 in 3 women will experience them at some stage. But while simple UTIs can be effectively resolved with antibiotics, recurring complex UTIs can be extremely difficult to treat.
If you develop 2 urinary tract infections in 6 months or 3 in a year, that's classified as recurrent urinary tract infection. You really need to think about what's going on there.
My frequency slowly grew to the point where 8 years had gone by and I had been going to the bathroom every 45 minutes to an hour.
About once a year, she'd be treated with antibiotics until they just stopped working.
It was terrifying, absolutely terrifying. I went 4 nights in total with not a wink of sleep. I thought, this is it, these are my last days.
Laura ended up in hospital.
They said there's no infection. I knew they were wrong. I went to 2 more hospitals. They were angry at me for coming in and wasting their time.
Sally's experience was similar. Her second urologist treated her for an overactive bladder.
She did 2 rounds of injecting Botox into my bladder. She tried every possible medication. They put an electrical stimulator in your ankle. None of these things worked.
Sally's doctor finally diagnosed her with endometriosis and booked her in for a hysterectomy.
I woke up from that surgery, that very specific pain was still there. That was the lowest part of my life because I literally felt I've run out of medical options. At that point, I was contemplating what the rest of my life would look like and if I would be able to keep living like how I had. But I refused to give up.
It was then that Sally found a support group online for women with chronic UTIs.
It was like, light bulb moment. All these people with exactly the same story as me.
Both Sally and Laura were advised to contact a London clinic run by Professor James Maloney.
I was on a plane straight away. He was just there looking at my urine, shaking his head in disbelief like, I can't believe you've been dealing with this.
They focus on your symptoms first, the test results second. That to me was mind-blowing and validating as well.
Both Laura and Sally were given a controversial treatment, long-term, high-dose antibiotics. It's been effective, but that treatment isn't officially available to patients in Australia, as our medical system doesn't recognise that UTIs can be chronic.
Professor Maloney is a divisive figure, but there's some work that he's done that is very thoughtful and has actually, I think, made us rethink how we look at this. We should be more than capable of providing this assistance and support here in Australia.
In Australia, our best UTI test, a midstream urine test, commonly fails for chronic infections. If an infection isn't completely cleared after a course of antibiotics, it can become embedded in the bladder, causing long-term problems.
Quite a lot of the presentations are not simple. Antibiotics may not actually even be right, but we won't be able to even get close to checking it because we're not doing any microbiology with that.
Compounding the problem, pharmacists are now allowed to dispense antibiotics for UTIs without a script from the doctor.
And, if appropriate, you can get treatment there and then. Easy peasy.
Associate Professor Magdalena Simonis questions the wisdom of this approach.
And we hear this all the time, that if we use antibiotics too frequently and unnecessarily, that we're running the risk of developing bacteria that are resistant to the antibiotics we have, and it's a global concern.
It wasn't easy, but Laura and Sally finally found Australian GPs willing to work on the advice from the UK. Both say they're feeling better.
I'm so happy, like beyond happy, to be where I am today.
I tell my GP that every time, that she saved my life. I don't know how I would have lived the rest of my life with those symptoms. I don't know how I would, so I'm still not quite there, but I've got my life back.
Wow. That's extraordinary, isn't it? Is it arrogance of doctors that women are not believed?
I think it's a bit of a medical gaslighting, you know. And
but what purpose does it serve? Is it that a doctor doesn't believe a woman who's saying she's urinating every 45 minutes?
I think the condition of hysteria was around until the early 80s, so...
Oh, listen, sometimes it still is. But that doesn't mean a problem can't be real.
Yeah.